It's a beautiful time again on your number one health program, reaching you from the station of excellence NTA Lagos Channel 10. This week our focus is on immunization. Immunization plays a significant role in saving lives and of course in promoting health equity worldwide. This week, as we join the rest of the world to celebrate World Immunization Week, we were able to interview a renowned medical practitioner, Dr. Yusuf Ademola Aron, who is also known as Dr.Love. He'll be telling us the challenges facing immunization and also the solutions to it. Plus, we have a special report on healthy lifestyle. This is one report you need to see. My name is Nkem or Kibe. I'm your regular host on the program. We'll go on a short break. When we return, you'll enjoy that interview with Dr. Yusuf Ademola Aron. Stay with us.
It's time to celebrate the brightest and most curious minds on the planet, our children. On this special day, we celebrate the creativity and excitement children brings to our life.
Somebody can say you're not saying anything.
The 2025 NTA Lagos Channel 10 Children's Day event will feature match pass, beauty pageant, dance competition, games, chess, Scrabble, table tennis, Ludo, and so much more. Watch your favorite artists perform, have fun, and play in our colorful bouncy castle. Send shoutouts and goodwill messages to your loved ones. All these will be happening on Tuesday, 27th May 2025. Venue, NTA Lagos Channel 10, Tedros Avenue, Yaba. Time, 10 a.m. Gate fee, 3,000 naira per child. There will be gift packs for every child and prizes for winners of the various competitions. For sponsorship and inquiries, please call Income 0706 086 5487, Chibuzo 0812 324 5519, Gmo 0803-830-1669. Date again, Tuesday, 27th May 2025. Venue, NTA Lagos Channel 10 premises, Tedros Yaba. Time, 10 a.m. Gate fee, 3,000 naira per child. The NTA Lagos Channel 10 Children's Day Party promises to be an unparalleled adventure. Happy Children's Day.
Immunization is simply the introduction of a vaccine or introduction of a substance into the human body, thereby providing or producing immunity and resistance against infections. A good example, which we all or we have heard about, is tuberculosis, TB. There was a time tuberculosis was affecting millions of people and killing them. And one of the pathognomonic feature, just to say it in an easy, one of the telltale signs in tuberculosis, as example, is coughing and producing blood. We call it hemoptysis, night sweats, losing weight, and there could be also many other signs like POTS TB, where somebody is even having pus coming out from the spinal cord. So in this kind of case, immunization was introduced, or vaccine was brought in, and the name of the vaccine is BCG, Bacillus Quemedguarin, and it was given at birth. The miracle is that once someone gets this vaccine or immunization, the person is relatively protected for life, unless there is an immunosuppression like HIV or on any other condition that can make the person fall into or develop the TB. So immunization, another example again is the flu vaccine. We've heard of flu, and this one is taken every year. So in the flu vaccine, you are given another substance which, when it's introduced into the body, the person develops resistance. And one of the things that you look for is that there are side effects. We may come to that, and there are complications. But the overall good and benefit of immunization is more than just this one, some complications or side effects. So immunization is very important. And Nigeria, together with many other countries, have an immunization scheme where people are given vaccines or immunized from birth, some even to 3, 4, 5 years. They are given some. So TB, BCG is one of it. Measles vaccine is another one. Yellow fever vaccine is given. There are many others like that are given based on the stage or the age of the individual. So it is very, very important that people take immunization. Another thing I would go on is Love for Health. We also have a soft spot for women, and we care for them specially. There's a vaccine which is very important in women, and that is the HPV vaccine, human papilloma virus vaccine. This prevents cervical cancer. So some women who are exposed during their reproductive age to this HPV virus, human papilloma virus, they can develop cervical cancer later in life. So once they take this vaccine, they are also immune from developing this deadly disease. Now, another thing is that some of these vaccines reduce the complications or reduce the severity of this disease. That's another aim of the vaccine. For example, if there are 2 people, one of them takes chickenpox vaccine, another one doesn't. The one who took the vaccines might develop mild rash, mild fever, mild symptoms. The one who didn't take the vaccine at all might develop worse cases of symptoms. And I've said there are comorbidities or comorbid cases that also affect or compromise with these vaccines. How effective are the vaccines? It's still a big question that we all are asking ourselves about in this society. Many mothers carry their children for immunization or for vaccination, but we don't know, were these vials, were they preserved in a standard way? For example, some of these vaccines have to be in a temperature less than 4 degrees centigrade or even 0 degrees. Some of them have to be in a cold room temperature, in a cold environment. So if these vaccines, Nigeria now, we have loss of power supply, the place may not be cold. Some are kept in the fridge. The fridge itself might be hot. I have worked in health centers and hospitals. I wouldn't want to mention any name of any private hospital where I worked in Lagos State, even in Ikeja, and there was no power supply, and they claimed that these vaccines are to prevent disease. Certainly, these mothers may come back with complaints of measles if they were given measles vaccines. Measles and yellow fever vaccines are usually given at 9 months. So if this child was given this kind of measles vaccine where the vaccine itself was not in a cold environment, it was not preserved based on the standard and its regulations, the child might develop the measles because there's something called potency. The vaccines may not be potent enough to prevent the disease or the infection because the shelf life has been altered, or the vaccine itself has expired, or it wasn't well preserved, so they can't get the adequate effectiveness, or the potency of these drugs or these vaccines are not properly preserved or are not properly effective. There's a particular book I read, and that book was published and stated, do not vaccine your children if you don't want to get the disease. So this is a myth, this is a misnomer. So there are some people who are advocating against vaccination. Also, some people are making money by producing wrong vaccines. Now, about some places where they are not getting, one of the major challenge and one of the problem is ignorance, lack of education, illiteracy. Another problem is poverty. We are in a society where the socioeconomic status, SES, is very, very low. Almost 90% of people living in Nigeria or Africa are living below the basic standard, and it's affecting. But one thing the government has done, and which they have to do better, is to improve in healthcare reach, community outreach, and also make sure that these vaccines are free. Most of these vaccines are free in government hospitals, in tertiary health, in primary health centers even. And when I was a kid, talking about close to 30, 40 years ago, there were women who used to put on these vaccine clothes, like OPV, oral polio vaccines, and they would go house to house to vaccinate or to give each family, each household, the vaccines from birth to even when they are about a year or two. They have the oral drop, they give them in their mouth. And it's worked effectively. Since I've grown up, I've not seen any child with polio. And there was a time Nigeria was even termed safe from this polio. That is, Nigeria relatively eradicated polio. Egypt also has eradicated polio. So that kind of health campaign, health awareness, has to be done both by the government and also by community leaders. Vaccinations or immunization usually takes years or decades even to even develop the immunity or resistance to this. COVID-19 was one of the exceptions. Within few months, the vaccine was developed. It wasn't that case in tuberculosis, in measles, in all other vaccines, rabies vaccine, there's even this rabies. So COVID-19 is an exception. So what we have to do is that we have to fund research. Nigeria and African countries, many other developing countries should fund research. We have many intelligent professors here. Unfortunately, many of my colleagues have traveled out, and I can't blame them because they are making more money there. So government has to fund. Also, we have to tackle corruption. Corruption in terms of, look at the COVID case, palliatives and vaccines or whatever was given. Some people were diverting these things. The same thing with even the vaccines. The USAID, UNICEF, the United Nations, World Health Organization is providing funds to Africa, Nigeria inclusive, providing vaccines, providing drugs, but they are not reaching the people. Sometimes they even change the expiration date of these vaccines. Government has to also enlighten the common man and woman on the streets that these vaccines are there to help them to provide resistance against disease. So government participation, individual participations, and that's why non-government organizations also, like Love for Health, is out there to support the government to campaign about health services, about vaccination, about immunization, and how all these methods can be used to prevent. We should always remember that prevention is better than cure. There are lots of them, but I'll just mention a few. BCG is one of the first one. That is for tuberculosis. A child should take that one. Another one is measles vaccine. A child should take it. Yellow fever vaccine. A child should take it. OPV, oral polio vaccines. A child should take that one also. So these are some of the many vaccines. These basic ones, a child should take them. One from their birth to when there are some they even take to when they are like 5 years. So then I mentioned some specific for genders. The women, HPV vaccine is good. A girl takes HPV vaccine even before she's 16, before she reaches the active, before she's active reproductively, before she starts even engaging in anything. She should take that vaccine to prevent cervical cancer. So these are part of the basic vaccines that people should take. Now, I advise parents to vaccinate. Everywhere I have practiced, everywhere I've lived, Saudi Arabia, USA, even Nigeria, they all vaccinate. They are all vaccinating. So vaccination, immunization is very essential for everybody. In each countries, their schedule or routine of vaccination or immunization varies. Also depending on the climatic environment, depending on the prevalence of diseases, and also depending on the public health system in the society. For example, in Nigeria, our own vaccine routine or immunization schedule is different from that of Saudi Arabia. And the immunization schedule in the United States of America is also different. Sometimes they even there are sometimes you are given some things that you may not call it vaccine, but you are given. For example, you might take vitamin A even, just to improve the eyesight. You can take all other things. So I also tetanus and things like that. So I appeal to all parents, particularly in the rural community, please let your children take these vaccines and let them complete their immunization schedule so they can be healthy and we can have a better society.
Thank you so much, Dr. Love, and thank you for stating the basic immunization a child needs to get. You agree with me that if you're in Lagos, Lagos State is doing a whole lot. Kudos to the Lagos State government to ensure that every child has access to immunization, especially if you live in far-reach areas in Lagos State. You can agree with me that most of the times when there's immunization, you see them going around to ensure that these children get immunized. Moving on, we have a report on healthy lifestyle. Let's take a look at that report. We'll be right back. Stay with us. Maintaining a healthy lifestyle is crucial for everyone, particularly given the alarming prevalence of disease today.
The important thing when it comes to healthy living is just keeping it simple and being consistent. I preach this thing all the time. A lot of the time people want to do extreme things and it's not sustainable. After one day, 1 month, 1 year, you stop and you go back to old habits. So simple habits that are sustainable. Okay? Simple exercise practice. It's better for you to do 2 push-ups a day, and then when it's easy for you, make it 5, then make it 10, then make it 20, than to just do 50 and then you try and maintain that every day. Do you understand? You can do things like, okay, this month I'm going to take off fizzy drinks. Next month I'm going to make sure I drink 2 cups of water extra than I normally do a day. Later you increase to 3, later increase to 4. Okay, I must take at least 2 oranges a day. Tomorrow I must take another one. Do you understand? Build healthy habits and you'll be grateful for it.
With the hustle and bustle of daily life and with the high rise of basic commodities, there is a common belief that living a healthy lifestyle requires a significant investment of both money and time.
I have a lot of bankers that are my patients, right? They say, oh, I have to wake up before traffic and all that. I said, fine. So when you wake up, why don't you just do some crunches, even if it's 10 crunches? As you stand up on your bed, do 50 jumping jacks. Buy a skipping rope. Do 50 skips. It will take you 1 minute. As you get better at it, you can increase to 100. Before you know it, you're doing 500 skips in 10 minutes. You just do that alone and you go to work, you're all right. Okay, you have lunch, Abi. Tell yourself, as I have my lunch, I must have it with 1 apple, 2 apples. Simple things like that. Just build it around your lifestyle, around your schedule, and it will become a part of you.
There are numerous benefits of healthy living, which makes it an essential investment for every individual.
There's financial benefits. If you are just staying healthy, a fruit can cost you 50 naira. But if you don't do that, when you catch a cold, the drug is more expensive. Okay? If you keep your sugar down and you're diabetic, okay, it might cost some money, but if you don't and you have organ failure, organ complications, it's more expensive. So it's cheaper for you, that's 1. 2, it does something for you. I can even attest to that. For example, when you exercise, you feel good, you carry your head high, your self-esteem goes up, you feel like you are showing yourself self-love, okay, and you inspire the people around you. You are more energetic, you are more willing to achieve things. Even doing 1 push-up before you leave, you feel like you've already achieved something in the day, right? So for your mental health is good, it's healthy, it's financially beneficial for you, and then it saves you in the long run all the complications of living an unhealthy life.
Embracing a healthy lifestyle through balanced habits, nutritious food, and regular exercise, no matter how little, can boost energy, increase life expectancy, and enhance overall well-being. And that's the much we can take on this week's edition of Health Watch. Remember that prevention is better and cheaper than cure. And remember that I normally say that health-conscious people live longer. You have questions, you have inquiries, please send a message to 07060865487 or send a mail to okibinkem@gmail.com. You know how much I love to see you every week. So join us next week for another interesting episode. Same time, same station. My name is Nkem Okibi. See you next week.